Welcome to the Executive Functioning for Parents and Kids YouTube channel. Hello, so today I want to talk about psychiatric hospitalization, but specifically when we should go. And first of all, I would say that if you're questioning if you should go, the answer is probably yes. Most people don't want to go to the hospital. A lot of times, if we're thinking about it, chances are we really should be going to the hospital. And I know it's a lot of stress and it's a lot of worry, but go. You need to go if you're not feeling well. Psychiatric hospitalization, the purpose is to get you stabilized and get you out. So it's like going to a regular hospital. They're not looking for cancer necessarily. They're looking to stabilize you so that you feel well enough to go home and see a specialist. And the same thing is true for psychiatric hospitalization, at least from my perspective and what I've seen. They are trying to get people stable and so they can go home. So the goal is not to keep you forever. The goal is to get you on some medication that can help so you can then go to therapy and psychiatric care outside of there. And sometimes they have step-down programs and they have residential for people that have severe issues that have been kind of like ongoing. And of course, there's always the extra piece of getting insurance to pay for all this and all that jam. So it's a little tricky, but psychiatric hospitalizations, if you need to go, it's really important for you to go and to understand how do I say this? To understand like the reasons you might want to go. So for us as a therapist, excuse the bunny in the background, we are looking at, are you potentially a harm to yourself or are you a harm to other people? So are you thinking about harming yourself? Are you thinking about harming someone else? Are you self-harming? All of these things that might put you in danger or put someone else's life in danger. These are the big things that will bring you into the hospital. So if you, I don't know, if you think of any of those things, you're anywhere on that spectrum of wanting to hurt yourself or someone else, you go to the hospital. And then they have a psychiatrist there that will then evaluate you and tell you if they think you actually need to be there. They're not just going to admit you. If you're like, actually, I feel warm and fuzzy right now. So if you said that, they'd be like, time to leave. They're probably not going to admit you unless they see some things that are concerning. So they can make that evaluation. It's sort of like, am I having a heart attack? If you think you're having a heart attack, you make sure you get help. Now that could mean calling the emergency room. If you're in a medical facility anyways, maybe just popping in and saying, my heart hurts, I don't know, whatever the case may be, but you get the quickest intervention you can get. And generally that's calling the ambulance. And you can call the ambulance for a psychiatric emergency too, but ideally you walk in and have some choice in it. But yeah, if you have any doubts, go. They will evaluate you and tell you if it's serious or not. Do not wait. It's really important to understand this, and it's important to not try to wait for a psychiatrist or a therapist to be available. Now, there's people like me, I work out of pocket. So like I have openings, like I will often have an opening that I can fit people in pretty quickly, but that doesn't mean that this is a solution for a true psychiatric emergency. You need to go to to the hospital. I can't medicate and I'm a therapist. I teach skills, I can help people, but it's a longer term help. Medication, if you are suicidal or homicidal, medication might be the solution that gets you to a point where you can actually use coping mechanisms that you learn in therapy. So it's really important to get the psychiatric care. Now, occasionally you can find a psychiatrist that can meet you pretty quickly, in which case, if you could get the same day appointment, you might be able to see about making some sort of safety plan, especially if you have family or if it's a child where parents can sleep in the room and supervise heavily. Being able to have that kind of support and get the medication at your psychiatrist that knows you and has your information, or even maybe just at your pediatrician or your PCP, potentially, depending on how knowledgeable they are about stuff, you could get that care that same day. Put those supports in place so you don't have an opportunity to hurt yourself or someone else while you're waiting for the medication to work. But the tricky thing about psychiatric medication, as always, is generally that it takes 4 to 8 weeks to work. There's some variations, but we want to make sure people are in a good place and able to go home and be safe, and not have to have people following them around, because there is that option where you have someone just supervising you 24/7, but that can't always happen. Sometimes with kids it happens because like there's a parent that can do that, but a lot of times there's not. And it's really important not to leave people home. I hate the idea of someone being without their loved one because that person didn't seek help or because the parent didn't seek help for the kids. It is a sad situation because a lot of times we think, oh, we have time, they're okay. But if you're in a bad enough place to even ask for therapy, sometimes that's the place where you need to be going to the hospital. Some people don't ask for help until it is an emergency. And it's important to understand which kind of person you are, if you're the one that's seeking help, or which person your child is. And so I say that almost always getting that psychiatric evaluation at the hospital is the right choice if you have any doubts at all. So I hope that was helpful. Please take it seriously. If someone feels like killing themselves, no one deserves to live like that. There are medications that can help, and there's therapy that can help, but we're looking at a medication situation. You can't just exercise or pray it away. There's a chemical imbalance, and I don't want to say it's okay because it's not okay to feel like that. It's not okay to feel like that. There needs to be something that changes. There needs to be medication. There needs to be therapy. There needs to be support, anything they need so they can feel better, because everyone deserves to live a happy life and not feel that bad. That's a pretty bad, icky feeling, to be that sad, or to be that angry, because sadness comes out as anger in some people. And that's why we may occasionally see homicidal ideation. So that sadness can look a lot like anger in some people. So we want to be able to get people the help they need, because everyone is important, and making sure everyone can live up to who they are and as a human being, and have a wonderful life it's just so valuable. We want everyone to be happy and healthy and mentally well and feel balanced. And sometimes we do need medication, and that's okay. Sometimes we do need a psychiatric hospitalization, and that's okay. But getting the support you need is really important, because you're important. So I hope that was helpful. Make sure to check in with someone. And again, you could consider seeing if you can find a psychiatrist that will see you the same day about medication, or a therapist that can see you the same day to see about safety planning or assessment. But overall, you're going to want to look at going to the hospital immediately, because a lot of times you just can't get that treatment that quickly. And a lot of times you need to be stable enough. Like if you're really feeling not good, going to therapy might not be super helpful. It actually might be like kind of tough to like rehash sad things when you're feeling that low. So please get the help you need. You're important. Have a good day. Take care. Learn more about executive functioning on happyhoneysuckle.org/blog.